All right. Good evening, everybody. Thanks for attending. So we are GSSA, a new club on campus, Global Surgery Student Alliance. Thanks for coming to this meeting. So the goal of this meeting is really just to talk through global surgery, the need for it, and then to talk about what our plans are for this year. So yeah, feel free to turn on your cameras or don't. It is not required, of course, but it would be kind of nice to see a few faces, but no pressure. So my name's Alfie Rotantulu. I'm the president of this club. I found out about it when two leaving fourth years a few months ago started the club, and I looked into it and I'm like, I love this. So I ran, and I'm excited to be the president of for this year. Can I have Nico and Jordan introduce yourselves really quick?
Hi guys, I'm Jordan Widows, LS2, interested in general surgery and sort of mission work, and so global surgery is a pretty good avenue down that path. But I'm a VP and I'm excited.
Hello, I'm Nico Belliard, also an MS2, and also interested in general surgery and global surgery, and just like humanitarian work and medicine in general. So yeah, this is a great club and glad you're all here.
Yeah, I'm Alfie, MS3. I was interested in ophthalmology because of all the mission things. Then I did a urology elective. Now that's at the top of my list. So interested in urology, but I am also interested in general surgery. So we'll see what happens during my third year clerkship with general surgery. So let's get straight into it. And if anyone needs to leave or anything, that's fine. Totally understand. This meeting is also going to be recorded for if anyone wants to see it afterwards. So can you guys see the slides? Okay, awesome. So global surgery, why does this matter to us? Well, when I was thinking about it, I mean, I think this should matter, especially at a school like Loma University. I'm sure many of us have a background in missions. Maybe some of us did student missions in undergrad. I'm sure many of us, most of us have a Christian background as well, where we kind of grew up with this calling to serve overseas. I mean, how many of us here wrote about wanting to serve maybe overseas or globally in our personal statements? I have a feeling it's more than a few. So what is global surgery? This presentation is based on the Lancet 2015 Commission for Global Surgery, which is this huge project from Lancet, which we'll talk about later. This presentation was first created by another member of the GSSA, Parissa Fala, and we edited these slides as well. Okay. So what is global surgery? It is a field that aims to improve health and health equity for all who are affected by surgical conditions or have a need for surgical care, with a particular focus on underserved populations in countries of all income levels, as well as populations in crisis, such as those experiencing conflict, displacement, and disaster. So basically, surgery for anyone that's underserved, including when events occur in places that need it. Sometimes medical situations change. For example, COVID, which we have all seen the effects of, or natural disasters. I mean, thinking about hurricanes, earthquakes, tsunamis, and the like. So surgical inequities. There's about 8 billion of us on this planet right now. And quick reminder, all these facts and everything are from the Lancet paper, which we'll get to later. That's where these statistics are coming from. But 5 billion, with a B, people lack adequate access to basic surgical care. So what does that statement mean? Well, in their paper, lacking adequate access means that within 2 hours of where they live, they cannot access the 3 bellwether procedures. Those procedures include a laparotomy, C-section, and treatment of open fractures. Laparotomy, C-section, and treatment of open fractures. According to this group, if you have access to all 3 of these, then they believe that there's enough surgical output and resources for the system to function at a good level of complexity. So 5 billion people lack access, which means they're more than 2 hours away, or if they're under 2 hours away, that they lack good access. And the poorest 30% of people in the world get 6.3% of surgeries. The richest 30% of people in the world get 75% of surgeries. So there is inequity there. So what are the implications of this lack of care? 77.2 million disability adjusted life years are lost per year due to the lack of surgical care. and 16.9 million deaths in 2010 occurred related to lack of surgery that could have been prevented. I remember the first time I went through this PowerPoint, I was thinking, where are these numbers coming from? Like, are they overestimating, underestimating? We'll get to that Lancet paper. I read through a lot of it, and lots of this data is actually conservative data. And all of these statistics are very well researched and have lots of evidence behind it. So 77 million disability adjusted life years. So people who lose these dailies cannot necessarily contribute to their family. They can't contribute to the country's economy. Basically, they can't live a fruitful life. So if health is a human right, should anyone have to live with a disability that could have been prevented had they lived somewhere else? And I think that's kind of the pulse of global surgery and why lots of us are interested in it. Should someone have to suffer based on where they were born? So there's a phrase called catastrophic health expenditure. Basically, this is when someone becomes put in a place where they are financially devastated due to a health reason. So 33 million people face CHEs due to receiving surgical care. So just by getting the surgical care, these 33 million people have now faced a catastrophic health expenditure. Additionally, 48.5 million face CHE due to trying to access surgical care, meaning that this group of people face the CHE just by trying to get to where they can have that access to surgery. Half the world is at risk for CHE if they needed surgery. Throughout this whole presentation as well, I'm thinking about my time as a third-year med student and all of these types of things that I'm seeing even in our own community. So it's just something to keep in our heads. We're talking about global health, but at the same time, there's also aspects of this just in our own communities that we get to serve as med students here. So in general, people are actually becoming poor while they're trying to save their own lives, and they're forced to pick between being sick or being poor. The burden of these CHEs falls almost entirely to the poor. They are 61 times more likely than the richer patients to experience CHE due to surgical care. So now economically, $20.7 trillion are lost by the global economy due to the lack of surgical access. $12.3 trillion specifically come from low to middle income countries. So from those two statistics, basically what this is saying is that in between the years of 2015 to 2030, this is how much the global economy is losing because people are dying or becoming or going through morbidity because of their lack of access to surgical care. And although the global numbers seem, pretty small compared to numbers like our national debt, that proportion is lost by low and middle income countries. And think about how that $12.3 trillion leaving their economy affects them in their smaller countries. So from this paper, they kind of did the math and they saw what it would take for global surgery access to be good between 2015 and 2030. And they found that that was $350 billion is what is needed to reach the WHO's goals, compared to the amount lost by the global economy. Now, it does feel wrong to be talking about, money and finances and the economics of all of this when people's lives are at stake, their livelihoods, their time with their family and their loved ones. But at the same time, these are things that we need to think about to make real changes in the eyes of policy and in government. So AIDS, tuberculosis, malaria. I mean, growing up, I'm sure we've all heard about all the money that's going towards these things. Bill Gates' fight against malaria. I remember his one talk where he released all of these mosquitoes in the crowd, and it was this huge thing. So much money is going to these infectious diseases, and it's absolutely vital to global health. Paul Farmer, one of the basically forefathers of global health, calls global surgery the forgotten stepchild. The thing about infectious disease and surgery are that they're actually really linked. For example, someone with tuberculosis might develop an empyema and they might need a chest tube or a thoracic procedure. Someone with Ebola might have uveitis, and that's seen to be a common cause of uveitis in those afflicted areas, which leads to reduced vision and or blindness. So an ophthalmologist might be needed to help these Ebola survivors. In addition, patients who present with surgical problems to the hospital may have their underlying infectious causes, such as malaria or HIV, found and then treated from there. So treating someone surgically can also help with their underlying health conditions as well. So let's talk numbers. I mean, deaths, right? From HIV and AIDS, 1.46 million people die per year. From TB, 1.2 million. Malaria, 1.17 million. I mean, that's a lot of people dying from these things. Deaths per year from lack of surgical care, 16.9 million. So surgery represents almost 30% of the global burden of disease. So why do you guys think that surgery has been ignored for so long? Anyone have any comments or input? You can just type it in the chat, speak up. Anything? Like, why are we so focused on infectious disease? What do you guys think about why surgery has been ignored?
Facility.
What's that?
Facility. Basically the infrastructure.
Yeah, the infrastructure. By the way, good to see you, Jeffrey. This man is an OMFS MS Form-Med student, greatest person I've ever met in my life. And I know you've gone on so many trips, Jeffrey. I was actually telling a dental student about you yesterday and saying he needs to contact you to find out how he can do it. But yeah, facilities. Any other answers? You type it in the chat. Any ideas? All right, Joseph, surgery might be more costly than malaria medications. That's very true. You know, to get everything there, it could be hundreds of thousands of millions versus just a medication. And Adele, it's more invasive and might require more resources than other interventions. Yeah, definitely. Good answers. Some other reasons, some people think it's not too cost effective. I mean, that makes sense to me too, millions of dollars. Of course, a few slides ago, we saw that overall, over many years, it is more cost effective, but these aren't numbers that we've had for too long. I mean, that number came from the 2015 paper that we'll share. Others think that it's too idealistic or impractical due to just how many resources it takes. Some feel that the importance of infectious disease is greater than surgery. And then lastly, there's a lack of emphasis on the loss of dailies, which is, you know, your livelihood as opposed to deaths. Whereas these infectious diseases kind of have an obvious cause of that death. The need for surgery might lead someone to have a less fruitful life. So there's many other reasons that we can talk about and think about. That's something that we'll be talking about throughout the year. So let's just look at this graph. This is again from the paper. These are the global distributions of surgeries. So the darkest red is the proportion of population without access to surgery. So as you can see in the US, you know, pretty good, light pink. And it's really this Central Africa, Southeast Asia area that needs the most surgeries. So here's another link. So this is the global distribution of SAOs. That stands for surgeons, anesthesiologists, and OB-GYNs per 100,000 people. So surgeons, anesthesiologists, and OB-GYNs per 100,000 people. So we can just click this link. This is a link that you can also look at later in your own time. But this just tells us how many of those SAOs per 100,000 people there are. So if you look at the US, okay, 64.6 surgical workers per 100,000 people. That's a good estimate. Let's check out Russia. 63.1, pretty similar. Australia, 49.3. Okay, I'm Indonesian. I hovered over Indonesia. There's not even a number there. So I don't know. And then, you know, like Central Africa, where we were talking about, 0.2 in Congo, 0.7 per 100,000 people in Rwanda. Malawi, where we have lots of connections through our global surgery department, 1.1, or sorry, Mozambique, where is it? 0.5 per 100,000 people. So overall, we can see that there is a lot of need around the world for surgical staff and for surgeons. So there are 3 basic delays to surgical care. The first delay is delay in seeking care. This is actually something that I've seen a lot during third year, during my few months. is whether it's cultural barriers, not understanding the need for treatment, just not realizing that you even need to get help in the first place. I mean, I saw one patient a few weeks ago, and she was there for a certain issue in the hospital, basically inability to breathe, pleural effusions. She's literally there for a few days before we realized that on her breast, there's this huge mass, like stage 4 breast cancer. We did more scans and it has already spread to her back, her brain. She's had it for years and she didn't even realize, that she probably should get it checked out. That's happening right here. And you can imagine that that's happening all around the world. Second delay is the delay in reaching care. So getting to the hospital, whether that's transportation issues, they live in a rural area, maybe there just aren't that many hospitals in the country. And then the third delay is the delay in receiving care, which is when the hospital may lack operating rooms or surgeons, there's poor primary care infrastructure, etc. And so we can look at each one of these delays and try to think of ways that maybe we can find solutions. And that's what global surgery is about. And that's what GSSA kind of wants to help find solutions to as well. So why does this burden and disparity exist? Well, like we talked about, surgery is resource intensive. We might have the lack of primary care infrastructure to support surgery, or there's a deficiency in the number of surgeons in these countries. Ultimately, overall, as we've seen, investing in surgery is cost effective and affordable. $350 billion over 2015 to 2030 can save 16.9 million lives and 77.2 million dailies per year. Of course, it's not about the money, but the economics is important to convince governments, policymakers, etc. But this picture, like this one right here alone, of a child who broke his leg and can't get it fixed, I think things like this are enough to convince any individual that surgery is a needed part of global health, and no one should have to live like this because of where they were born in the world. And all of us as medical students, have this ability to help. We're kind of at a place where our futures right now are unwritten, and we have the ability to play a role in helping those that are less fortunate around the world. So like I said, all of this data was from the Lancet Commission on Global Surgery. Nico, if you could share the link. It's this super long paper with people from over 110 countries, and they just did a bunch of research and they decided to put it all in one paper. So there's just amazing data to look at there if you ever want to look at it. And that's what a lot of the initiatives right now about global surgery have are based off of. So the goals for 2030 from this paper, 143 million additional surgical procedures a year. Right now, just to have context, we're doing about 313 million surgical procedures per year. So we need a 150% increase in the number of surgeries per year to reach the goals for 2030. Is it possible? Well, I think we can have a role in that. Their goals are also to have 5,000 procedures per 100,000 people. We need 2.2 million more surgeons, anesthesiologists, and OB-GYN surgeons to reach goals. And then their last goal that is on this slide, at least, is for 80% of a population in a country to have access and coverage to essential surgical and anesthesia services. So next is a little video, 2-minute video to summarize what we talked about so far. And then we'll move on and talk about what we want to do as GSSA here and our role here.
Over the past 2 decades, global health has focused on individual diseases. Surgical care has been afforded low priority in the world's poorest regions, leaving 5 billion people without access to safe, affordable surgical and anesthesia care. Patients requiring surgical treatment will face multiple hurdles: delay in seeking care, delay in reaching care, delay in receiving care. Reaching the hospital does not guarantee treatment, as many lack the proper infrastructure to provide emergency surgical care. As a result, many easily treatable conditions become diseases with high fatality rates. As many as 90% of maternal deaths could be averted by timely intervention. For those who successfully obtain treatment, 1/4 will experience financial catastrophe as a result of receiving surgical care. To save lives and prevent disability, an additional 143 million surgical procedures are required annually in developing countries. Today's surgical workforce would need to double in 15 years to reach our target of 80% coverage of timely access to essential services by 2030. The total costs required to reach these targets are significant, at approximately $350 billion by 2030. However, the costs of failure are even greater. The lost output will cost developing countries an estimated $12.3 trillion. Investing in surgical services is affordable, saves lives, and promotes economic growth, making surgery an indivisible, indispensable part of healthcare.
All right, Nico, and you have this next part here.
All right. Thanks for sharing so far, Alfie. So what are the things we can do? As medical students, we like action. That's why many of us went into medicine. And some of the things that often come to mind are like surgical missions and short-term missions. There are also some specialty surgery organizations that go overseas and do and perform procedures globally. And there's also organizations that are out there that provide resources for hospitals in these low and middle income countries. There are also programs such as the PACS program that I'll talk about in just a bit that basically have fellows that are being trained overseas. And also a lot of times people from developing countries will come to places like the US and be trained here and then go back to their countries. However, these are like some of the traditional models we see in approaches to global surgery, but there are a few issues with these, and it's important to emphasize that the goal of global surgery in the long term is sustainable interventions that help train surgeons from within the countries that are needing surgeons for their population. And the main point is that we help without hurting, and so that we're not going in and creating dependency and a kind of colonialist approach to global surgery. And so on the next slide, basically the approach of the GSSA organization and what Loma Linda is trying to do with some of the programs we have in place here is to kind of have a bi-directional exchange of knowledge. And so I mentioned the PACS program, which stands for the Pan-African Academy of Christian Surgeons. And basically this is a program that trains residents across the continent of Africa at different accredited hospitals. And Loma Linda is one of the accrediting bodies that helps certify and graduate African residents who are training there. And so one of the Adventist hospitals in Malawi, Malamulo Hospital, is actually one of the training hospitals for this PACS organization. Another element of sustainability is using local resources. And then, as I was talking about, just training surgeons from within the country so that you break that need for dependency, and also just creating a culture of more in-house training. So implementation, as far as implementation, the Lancet article goes into great depth. There's a lot of details in there about how we can actually implement global surgery interventions. So we won't go into the details of that. We'll definitely have to continue this conversation in the future. But one thing that one of the surgeons here at Loma Linda, Dr. Neftali Gomez, has talked about is how can we create sustainable and ethical short-term mission trips so that we can still, partake in these and get involved, because not all of us can always, go overseas for 6 months especially depending on the time in our lives. But how can we do these short-term mission trips so that they're effective and still sustainable? And so stay tuned for a upcoming presentation, hopefully with Dr. Gomez, and he'll kind of talk about that and what can be done there. And finally, on the next slide, basically, these are a list of all the different, well, it's not exhaustive, but a list of some of the different specialties that are definitely needed in global surgery. Many of us that are, first and second years are still thinking about what we want to go to residency for. And a lot of things are intuitive, but just thinking here, trauma and ortho is definitely a huge thing. OB-GYN, 15% of all pregnancies result in complications that need emergency obstetric care. So whether or not these women have access to a OB-GYN, these pregnancies are happening. And so there is a huge need for OB-GYN doctors overseas and in the US as well. And then 65% of all cancer is curable or controlled via surgical interventions. So we need more surgical oncologists. And as these low and middle income countries start to make a transition into more developed countries, the types of diseases and the epidemiology is changing and shifting. So we'll be seeing more of a need for cancer and surgical oncology interventions in a lot of these developing countries here in the coming years. All right, and next, Alfie will just talk about some of the things that GSSA is about and what we're doing.
Thanks, Nico, for sharing. I mean, I think that's the most interesting part of all of this, is that no matter what we end up doing and whatever we end up applying over these next few years, there's a need for us for sure. So we are the Global Surgery Student Alliance, of course. So this is a national student-run global surgery working group for the US. It's also affiliated with Incision, which includes student groups from over 30 countries. As far as what GSSA is, they have student groups at 59 medical schools across the US. So it's really cool to be able to work with other medical schools and collaborate with them. For example, this Wednesday, we have our quarterly meeting with the regional chapter. So this Wednesday, Nico and I will be meeting with the GSSA representatives from the medical schools of the West region, schools like University of Arizona, UCLA, University of Washington, and more. Anyways, it's really cool to all come together to have one goal, which is to increase access to safe and affordable surgery. So really quick, the vision of GSSA is sustainable and accessible surgical, obstetric, and anesthesia care worldwide. The mission is to educate, inspire, and unite students through engagement and mentorship in global surgery, including anesthesia and OB-GYN. And that's the website right there. I think, especially at a place like Loma Linda, as I mentioned at the beginning, I feel like we are a university that's kind of meant for something like Global Surgery Student Alliance, which is just banding together to hopefully try to help where help is needed all around the world. So one way that we can work with GSSA is something called the Global Surge Box, which is something that we're planning on doing in 2023. This is something that was founded by a few residents. Now it's kind of spearheaded from the University of Colorado School of Medicine through their GSSA chapter. And what this is, it's really cool. They cost about $25 to make these boxes. And there's a bunch of things that you can do, like you can suture and you can practice your vascular anastomoses, and you can basically just create a bunch of modules to practice your surgical skills. So how GSSA can be involved is we can look for grants, which we'll work on over the next few months to pay for these. And we would have a keep one, give one model where, a group of us come together, maybe 25 of us or so, and we build 50. 25 of them we'll get to keep and we'll get to use through different skills labs. And then the other 25 we'll send somewhere else. So I was talking to one of the founders of this, who's now a CT surgery attending now at Stanford, actually. And I was talking to her, asking her okay, if we build these, where can we send them? And she was saying that now at 2 medical schools in Africa, and this is expanding, they're trying to give these to all of their medical students. to practice their surgical skills on. So for us, you're thinking, what can we do to help? By us making these boxes and sending them overseas, hopefully this creates more surgeons in Africa so that they can practice and then improve their surgical skills and help out their communities and their homes over there. So that's one of the events that we're thinking of having and that we're likely to have. Otherwise, we'll have some events with speakers. We talked about how Dr. Gomez wants to talk about how to create sustainable short-term missions. We do have a suture lab and knot tying lab. That's November 14th at 7 p.m. That one is set in stone, so we'll send more reminders about that. Otherwise, around January, we're planning on having a movie night with discussion for SEOH credit, having a GSSA box, like a building party for that box, and then learning how to practice on it. And then just working with all of the global surgeons here around our campus and associated with Loma Linda. Lots of them just want to have an opportunity to talk to us and to inspire us. So as we kind of plan those meetings with them and find their availability, we will reach out to all of you guys in the school to see whoever's interested. Personally, I like food, so hopefully there will be free food at every single one of these because that's what gets me out of my house. Overall, global surgery at Loma Linda. So we're working closely with the Center for Global Surgery, which is basically Dr. Ryan Hayton's thing where we meet the first Wednesday of every month and then discuss research, discuss upcoming trips, discuss changes. We're also working with the Global Surgery Fellowship. It's a 1-year fellowship that you can do after global surgery. So it's honestly just good to get involved with us if you're interested in applying to surgery. You get to know the attendings on campus, and if you've ever tried to get FaceTime with them, you've realized how busy they are and how hard it is to meet them. So if you're involved with us, we can get you in the same room with them, like in the meetings for the Center for Global Surgery. For example, like I'm working with Dr. Gomez and Dr. Hayton, who are the PD or program director and assistant program director for like Global Surgery Fellowship in creating the website for this fellowship. So there's just lots of opportunities to get connected with these surgeons, get research, help out, learn more from them. Otherwise, learning about trips for after first year during that summer or during the 4th year month-long mission elective, GSSA will also be a good resource for finding out more information about that. Otherwise, SIMS trips and leadership opportunities. We still need class representatives, MS 1 through 4. So if you're interested, send any of us an email. We're looking to expand our leadership team so that we can do even more and plan more events. So in conclusion, we have a quote. Undoubtedly, it is within your power to contribute significantly to shaping the societies of the coming century. Youth can move the world. So, I mean, especially for you first 2 years, I know what it's like to sit in front of a computer and to just keep studying and feel like there's no reason behind what we're doing. But honestly, we have a large role in the future of global health, and we have a large role in the future of global surgery if we accept that call. These students like us can inspire those that are already involved in the field, where we can help with research, help on these trips, help motivate surgeons right now to go and serve overseas as well. So ultimately, we need to remember that we're making a significant impact, and the things that we're doing right now can change many, many lives in the future. And it's just up to us to recognize the need and to accept the call. So here are some references. For more info, you can contact any of us. Again, if you're interested in maybe being a student representative, send any of us a text, email, whatever. But yeah, thanks for listening. This was really fun to think about, to talk about, to prepare, and to learn more about global surgery. As we talked about, we have events currently planned, but we have an exhaustive list of possible events that we're talking about doing as well over the next few months. So keep a lookout for that. Are there any questions? You can put them in the chat, speak up. That was our short presentation about global surgery. And of course, we could talk about it for many, many hours at a later time.
I think Jeffrey asked if we can get access to the PowerPoint. You have a recording of this, right, Alfie?
I do. So I'll share the recording, but I'll also just send a link to the PowerPoint. And like I said, at first I saw the PowerPoint, I'm like, oh, cool. Okay, statistics. But when I actually just spent like, it took less than an hour to like kind of skim through it. But when I sat down and started to read it, I'm like, oh, this is good stuff that we need to get involved. So I would also recommend just like opening up the Lancet paper and just starting to skim. And I think it'll draw you in. So I'll send that to the group. Okay, well, thank you for attending, everyone, and thanks for learning about global surgery student lines and about global surgery. We'll stay in touch and let you guys all know about any future events, which will include learning about what's happening right now, learning skills, and eating free food. So peace out.